In New York, enrollment is mostly a paper process. So people fill out a paper application, mail it in to a local district for Medicaid, and it's a process that's pretty paper and document heavy.
The enrollment process in Tennessee is very paper-based, unfortunately. Members file paper applications through the mail or they bring them into county offices. It takes a lot of time to process applications. It takes a lot of money to pay for all the staff across the state that take those applications.
As they exist now, online applications are not graphical, not intuitive, and are difficult to use. The current approach to enrollment cannot handle 40 million new applicants.
There will be one shot at this level of effort, at the funding, at the timelines to make the health insurance exchange successful. So wherever possible, we want to get the best resources as quickly as possible and at the best value to the taxpayers.
It seemed to us that an important role we in foundation world could play would be to help with the task of simplifying and modernizing the process by which people enroll in coverage. So we figured while there are an awful lot of things for everybody to do here to prepare for this act, that one of the roles we could play would be to help catalyze a public-private partnership that could create a really state-of-the-art method for people to enroll in public and private insurance, and we picked a world-class design firm, IDEO, to help do that. As you know, to make something complicated, you don't have to really understand it well. To make something simple, you have to understand it well. And so we wanted a firm that really understood design and that could help simplify this process to make the act of enrolling easier for people, more like the way in which we now buy things and communicate with each other, kind of a modern world-class interface.
The design process was structured to maximize cross-state collaboration, to ensure compliance with federal law and regulation, and to lower development costs for all the states and for the federal government.
It was very clear to us right away that no one state could bring to the table what that collaborative was able to bring to the table. And it really did play out that way. There was a lot of give and take, a lot of input, and I think the final product is exactly what we were all hoping for.
It's probably something that we would not have been able to do on our own, and gives us a new level of comfort that this is a product that will be able to be used by anyone in our state.
Like many projects here at IDEO, we do have a deep commitment to understanding what it is that people really feel when they involve in services, products, experiences. Our team went to Louisiana, into California, to Ohio, and we talked to a whole lot of people that have a range of socio-demographic profiles and a range of experiences and stories with health insurance enrollment. And so we spent months really trying out different solutions for filing your tax credit application, different solutions for looking at plans, comparing them and purchasing them. We made prototypes of them. We put them in front of users. We asked them questions, not just about how well they work, but also about how they feel when they're using them. The model that we developed separates those experiences. So at one moment, consumers can understand their filters, and their filters aren't quantitative numeric sliders, they're human-centered questions that really ask about how people anticipate using a healthcare program. This filters the plans down, and then people pivot to comparing plans, and they see all of the plan data in the same place. They don't have to navigate to a new page in our model. 3 sets of information is the most data most consumers can retain, and so we looked at a model that would allow people to look at sets of 3 and then deal with their filtering separately.
The plan selection piece is really nice. We know that was very hard. There was a lot of refinement along the way to get what I think is really the best plan comparison we've seen.
The design standard that we've developed really helps to keep people focused and moving through that process with a sense of progression and continuity that gets them to the end of the application and also gets all their questions answered.
The UX design takes what was a many-step process from the point of an individual providing information to the point that they received a benefit, and pulls it together into a single web portal. You can take a picture of your pay stubs using your mobile phone and send those in as your verification. Or you can go online and chat with an assister or with the Exchange Customer Service Center. The design doesn't rely on a single vendor, doesn't rely on a single software product, or on a specific IT platform.
We knew very quickly that Alabama wanted to be involved in the UX 2014 process. It was clear that they had the expertise, it was clear they had a mission and the resources to make it happen. It's important to us because, quite frankly, the timelines involved to make this extremely complex project happen are very, very short. And so any resource that we can rely on, especially one that has the scope and the expertise that UX brings to the table, we want to take advantage of that.
New York plans to use the UX 2014 design, and as we build out our system, we know that the design is easily customizable to our needs.
Tennessee intends to move forward and implement the UX 2014 project because we want to move our application process into the 21st century and have a modern, user interactive online application.
We can save the state a lot of money by having folks use that web interface rather than having to come in person or on the phone or through mail.
We hope that the Enroll UX, or UX for User Experience 2014, represents a new standard for enrolling in public and private insurance. Because the Affordable Care Act makes insurance much more broadly available for people, we wanted something that would welcome people, because the whole point of the Act is to get people covered.
ShockwaveSound.com